Newark Beth Israel has the luxury of actually attracting some of the best talent in terms of medical providers in the world. They come from all over, and this is for a cohort of patients who is incredibly sick, who have been chronically sick for a long time, and there is a lot of anxiety and emotional duress on behalf of the patients and their families. One of the things that we emphasize is that not only do we have to actually treat the patients, but we have to treat their families, and that means not only their physical body, but help put them at ease. This is a very complicated system, and in terms of a disease process, and we need to make you feel, to the extent that we can with all of those people, like this is a home, like a place where in fact you can actually relax because you actually have hope and will get better. One of the reasons that I wanted to come to Newark Beth Israel was because in fact this is a world-class program. It is known both nationally and internationally. Sometimes that's easy to forget when this is your own backyard, but in fact that's true. From a man who was raised in the South but born in the Northeast and has lived all over the world, including Switzerland, it's hard to appreciate how wonderful your backyard and your family sometimes is until you leave home and then you come home again. We are here to help the community, patients, other physicians, and other hospitals get the best outcomes for their patients in conjunction with their private docs. In some ways, I look at all the clinical trials and I look at all of the data, and then I figure out how it is to actually apply that to a particular patient, a patient. On the other side, I use my basic science background and I think about the biochemistry and the cells and the cell signaling related to the disease that that individual patient has. The third thing I think about is I think about, after doing this for 25 years, what have I actually seen and what produces the best outcome? On top of all of that, I put an umbrella of probably the most important thing. The expectation that people should have is that I treat them exactly like I would treat my family. And when all three of those things that I just mentioned don't give you the answer that you're looking for, or a very clear answer, asking yourself, how would I actually handle my own family, is the way that people should expect that I will actually treat them and deliver care to them. And that is my expectation for all of our team.